Welcome to Autism Parent Care. At Autism Parent Care, we offer ABA therapy and combined with our unique approach. We support the parents psychologically and we help parents visualize the progress of ABA therapy on their child as intervention progresses. What is the main characteristics of autism? There are three main areas of impairment. The first one, social interaction. The child with autism may not use body language and may not be able to share spontaneously unless prompted. There's also a lack of social, emotional reciprocity, and because of that, they fail to develop adequate peer relationships. The second characteristic of autism is impairment in verbal and nonverbal communication. The child with autism may have delayed or lack of spoken language and gestures. They may not speak a word, or they just have a paucity of words. They may not be able to initiate conversation or maintain a conversation. Conversations may look like a question-answer sessions. They may have repetitive and idiosyncratic use of language. Because they tend to be concrete thinkers, they may also lack pretend play. The third characteristic of autism is restrictive behavior. So the child may have restricted repertoire of activities and interests, such as just being interested in Minecraft. They may be preoccupied with that interest and will only talk about Minecraft. They may be inflexible in terms of wanting certain routines, insistent on sameness, and they may also have repetitive movements such as hand flapping. And in addition to inflexible adherence to something, they may also have inflexible thinking and demand that everybody comply to the way they think. They may be preoccupied with parts of an object, such as the wheel on a truck or parts of any subjects, and miss the big picture. How is autism diagnosed? The Autism Diagnostic Observation Schedule, ADOS, is the gold standard for assessing and diagnosing autism. It's used across ages, developmental levels, and language skills. It was created by Dr. Catherine Lord and her associates in 1989. This is the EEG trace of a typical child that I work with. He's doing a mathematical problem. As you can see, the brainwave trace is going along steadily. This is the EEG trace from a child with autism. As you can see, the brainwave trace is hobbling along and he's making effort, not getting very far. As you have seen earlier, there are changes in brain functions in autism. The earlier the intervention, the better it is to regain better functioning. Typical interventions are occupational therapy, speech therapy, physical therapy, psychological support. And featured in our clinic that we offer is applied behavior analysis, ABA therapy. There are also other therapies such as developmental, individual difference, relationship-based, or floor time models. We are here to help at Autism Parent Care. The first goal is being able to take care of oneself. Hygiene, self-care, going to the bathroom, showering, toothbrushing, and these are the first thing that is necessary, and we address that. The second point is being able to attend socially, greetings, keeping eye contact, noticing others in the room, and maintaining social relationships. And thirdly, thinking and cognitions and higher order thought processes are very important. We recognize that, and we help maximize this with special tools for learning. And And once the child has developed all these, it's time to be able to get into the community and be able to tolerate going to the store, the restaurant, wait for meals, and go to a movie theater. This helps restore normal functioning in the family. For those who have problems with emotional regulation and experience a lot of tantrum because he or she is frustrated, we help them find the best coping and tolerance skills that's possible. We help them develop emotional maturity and be able to relate to families appropriately. And highly featured in our program is language and communication skill. The better someone is able to communicate, then the more adjustment he or she can have in the community. So we have had a lot of success converting nonverbal to verbal functioning. And it is not all work. We all need to be able to play and enjoy leisure time. Believe it or not, it is a skill that needs to be taught. And also, our aim is to mainstream children from our clinic into the school. So we help with pre-academic skills. Other aspects of an ABA program includes reduction of interfering or inappropriate behaviors, such as self-injurious behaviors, head banging, and so on. We want each child to be safe. We want each child to realize what is safe and what is not, and these are specifically taught. Not everyone with autism understands that they have to stand up for themselves. It is very important because they are vulnerable. Self-advocacy skills and independence so that they are not reliant on their caretakers all the time. They are very important. They have to learn self-management and be proactive in developing and maintaining social relationships. They also need to be prepared for work from the beginning, not at the end as a teenager, as is typically done in the typical group. Vocational skill training takes into account what the talent that is in them. Each of us have some talent. Let's not just look at deficits. Let's look at what is good in each one of us and develop them. And finally, how do we know if the work that we have done has resulted in changes in the brain? Because after all, this is a brain-based condition. With brain mapping visualization that is developed in Autism Parent Care, we can provide you with a pictorial representation of our progress. My name is Dr. Jane Yip. I am a BCBA. I am the Director of Autism Parent Care. You can get in touch with us at autismparentcare.com. Phone number 317-688-1260. We look forward to hearing from you.